about various topics related to endodontics. And without any further ado, Dr. Short.
Well, people, I'll just sit up here and just read to you guys. I like it interactive, so I want you guys to ask questions. I'm going to ask you a question. So, here we go. So we got some high-tech installations here, okay? So you can see this guy here. He's kind of relaxed. You can just use a manual file and just file on the way you get that occlusion just right. It's clean. So this kind of hung it on the outside of the bucket there. And also with mobile. So I'm going to show you a little quick movie of my life. I just want to be here to do the best I can and be the best at what I do.
I always hear about pain. I didn't even have anything. He did.
They are doing huge concerts. So
He was very comfortable and relaxing, and whenever I was in the chair, he just made me feel very comfortable. Because I was
Experience than say, one person trying to do everything. You can't be perfect at it all.
technically and skillful.
Comforts or any minor things.
just the experience of being able to touch someone who's been hurting and they can't afford any treatment, and to be able to turn their life around. And the third one is going to be on retreatment. So we'll take small breaks in between those three. And so I believe that we can get to the root of just about any problem. You know what? I love what you do. I said, okay, good. Neither one. Okay? So what do you guys think is going on here? In this area? All right. So yeah, you want to do cold or hot test. And I think when the oral surgeon took the tooth out, they actually traumatized the apical part of the second premolar. So, hey, this extract, yeah, we can always extract the tooth. Apical, you don't want to do an apical on the tooth, an apical on any of that, because the asymptomatic instrument is separated. It's a stainless steel file. Everybody heard of having hip replacements, knee replacements? They put stainless steel, titanium in your body all the time. The process can take anywhere between 5 to 8 years to complete. So it's like 3 steps. You have to, there's a written case. Periodontal ligament is affected. So that answers the question about how can periodontal disease, serious periodontal disease, affect the pulpal health. Sometimes when those just jump in there and do the endo if the pulp is healthy. We're going to talk a little bit more about that. Got a question?
On that previous x-ray, you had big
Apex radiographically. I'm going to show you the difference. There's a line between pulp testing, areolas away, tapping on it, nothing. So what else? All right, cementoma. Cementoma. Actually, this was a case of periapical testing. This is a totally different diagnosis of the pulp, periapical testing. This is where we actually like pulp testers. This is just one type that we make. Let's talk about classification of disease, because in order to place for 10, 15 seconds, like, man, on it, patients say, oh, it doesn't even hurt. And looking like, man, you have like this big area down there. You're not hurting. Why don't you hurt it? The second one is acute apical X-ray. And there's no way you can accurately do that. So you have to use all the armamentarium that's given. You have to use periodontal up to date. And we use microscopes. So can I say this buccal canal that was very calcified. Histologically, there's no such thing as a product. 7%. So now what I do, I'll go as far as I can go, and I feel like I'm going into the furcation. You can see this here. A lot of dentistry done on this tooth here. Probing, deep probing to a narrow-based sinus tract that exited through the sulcus. Another canal, this canal, had bacteria in there that, for whatever reason, the original root canal treatment, significant osseous repair was, this hotel was patient sent them to the periodontist. They reflected the flap and saw completely the distance over the bone. So they did root planing. This was in the era where you still got some 3 months post-op after completion of the root canal. Perio. Say endo. Not say endo. Say endo. Sinus tract. Anybody know what this is? Gutta percha, all right. So why do y'all think I put the gutta percha in there? Touch this with a 10-foot pole. We leave it alone. Okay, unless we see breakdown or the patient becomes some palatal swelling there. These are the x-rays. Middle-aged, black female, hint, hint, hint.
Okay.
Okay,
Semen tone.
sementoma. All right, so just make sure that when you see some of these cases, make sure you accurately diagnose, because the Pope status was normal, but it's just that, you know, your gut, when you see that dark area, it's like, oh, previous root canal treated, patient was in a lot of pain. What do you think the problem is? Number 30. To me, that root canal doesn't look bad. All right, yeah, it could be cracked. It could be cracked. So I see these cases quite often, and patients like, oh, my dentist think that I'm crazy. He think I just want drugs. This thing is killing me. So you want to be a star by making sure if you do some of these endos, you know, this is before he died, right? This is the X-ray. Came in like that way. Let me go into this tooth, because I think that you do have a tooth issue. You chew on those things, they can crack the teeth. They're called microscopic cracks. These are cracks that you won't ever be able to see clinically, ever. Okay? So we open the tooth up under the microscope. All right? Let's see. Troops. So I thought that was pretty cool. So, tooth number 18. Don't do anything fancy, no permanent crown, nothing like that. See what's going. She said, oh, I was supposed to go back and see, put a restoration in and see what happens. So the patient actually